I became a doctor because I love talking to patients and doing the detective work to figure out what's going on with them and have those one-on-one moments that are so special. And I was curious about if, there would be any barriers to becoming a physician. And I was actually told there was nothing to worry about because girl power, we've reached gender parity with 50% of medical school classes being women. So when I began to experience gender bias in medical school and later in residency, it was very unsettling. And some of the things that happened were subtle, and some were much less subtle. And when I would reach out to oftentimes the men that surrounded me in a male, dominated specialty, I was told they didn't understand, they didn't get it. And that resulted in gaslighting. And I didn't know what gaslighting was. I didn't have that term in my vocabulary. It was many years later when I began to connect with other women that were experiencing similar phenomenon that my experiences were actually very common, the norm for women in medicine. And I'm very excited that we're hosting our first retreat, April 5th through 7th in Huntington Beach, California. And we founded this retreat to be a space, a small group setting in which you can really explore what fills your cup, what excites you. Maybe it's staying in the role you are now, but shifting the focus. Maybe it's changing things completely, but coming together in person to have these critical conversations, to really share what we're seeing is so vital to ensuring that women come into medicine and that they can have the careers that they deserve, because we all work so hard. We deserve not only to survive medicine, but to thrive as well.